Now we are discussing the characteristics of MLC, which we have seen in the previous class. Some of the characteristics. Okay, so it should be relative with the conventional jars. So the types can be a single focused or a double focused, and the physical characteristics and the shapes of the leaves differs from machines to machines and usages. Okay, and the leaf movements determine the intensity level, and by adjusting the leaves of the MLC, okay, multi-leaf collimator, okay, MLC. So then multi-leaf collimator, by adjusting the leaf, we can able to fix the beam with the planned treated volume, or we can restrict the beam within the irradiated volume. Okay, so these are the three types. The first type, as we see in the last class. Okay, so the first machine from Electa, the next one is from Siemens, the next one is from the Variant. Okay, so the leaf can able to control the beam intensity. That is what the name intensity modulation. Okay, like how you define, like the amplitude modulation is defined as the amplitude of the carrier varied with respect to the input signal. Similarly, the leaf will vary accordingly. The intensity will be modulated based on the dose distribution. Okay, so we'll continue. So the most MLCs have cutting tongue and grooving pattern on the sides of the leaves. Okay, so the beam comes from the top. The grooves can move their directions. Okay, it's called tongue. It which stops the beam or it allows the beams. Okay, so it can move. You can see that there is an axis drawn as the center. With the center, it can able to rotate, and it can turn and twist. Okay, in directions it can move, so that it can control the radiation leakage. Okay, so generation of the motion files. Now there are leaves. You can find that there are the leaves present here. Okay, so these leaves A and leaf A and leaf B, they have to be moved based on the program. Okay, because the program only is going to control any machines. Today we use embedded system. Okay, so embedded system is nothing but I am embedding a software into a hardware, which is nothing but a microcontroller. So microcontroller has all the interfacing components, ports, etc., that can be connected with the different motors to have the control of this leaves. Okay, you can have motors, you can have levers, you can have gears. Okay, so different motors are used. You have stepper motors. Okay, several motors are used to control the operation of these devices. Okay, so it's completely programmable. Okay, so that's what the motion of the leaf. Okay, it is being controlled. So the leaf sequencer is an algorithm that translates the beam intensity pattern produced by the IP system into an instruction set describing how to move the MLC leaves during the beam delivery. Okay, so a beam is fixed. So it is like a program which learns the beam and learns the three-dimensional view of the data. Okay, and the three-dimensional data based on the dose histogram, we have three beam has to be applied. Okay, so that's what in the morning class we have seen. In a tumor, how the tumor is focused in three different directions. Okay, so that is what, when you do it with the three different directions, you can able to focus the complete tumor. Okay, so those things is been programmed, and accordingly the leaf sequencer will move. Okay, so that has been done by 2D intensity profiles, and those profiles have values in a matrix. Those values will control the leaf motion. Okay, so this is a very important one in IMRT. When I say as intensity modulated radiation therapy, the very important phenomenon is the leaf motion. Okay, the MLC. In the MLC, the leaf motion plays a very important role. Okay, next is the DMLC. Okay, delivers with a sliding window the beam towards the tumor. Okay, so here we have a static delivery, which means that it doesn't varies itself during the process. It will do step and shoot. Okay, it will go by step based on the 2D intensity profile. Okay, that is what the profile will be obtained from the dose histogram. Okay, from the dose histogram we know that from which direction, what is the beam intensity we have to apply. Okay, so let me show a video so that now you can easily understand on that.
Your doctor may recommend intensity modulated radiation therapy, a procedure that treats certain forms of cancer to kill cancer cells or control their growth. The cells in the body grow and divide as part of the normal cell cycle. The cell's nucleus controls this process. Inside each nucleus, genetic material called DNA contains the instructions for directing this process. Sometimes the cell's DNA becomes damaged. Normally, the DNA responds by either repairing itself or instructing the cell to die. In cancer, however, the parts of the cell's DNA that direct cell division become damaged. When these sections are damaged, the DNA is unable to repair itself. Instead, the unrepaired DNA causes the cell to grow and divide uncontrollably into more damaged cells called cancer cells. A tumor forms as the cancer cells multiply and displace the normal cells. Radiation kills cancer cells by inflicting overwhelming damage to their DNA. The tumor shrinks as the cells stop dividing and die. If the tumor is in your head, your radiation therapist may make a mesh frame or mask that will keep you positioned correctly during the IMRT. Or you will get small permanent tattoos to help align the IMRT. Next, your therapist will do a CT scan of your head to get a detailed picture of your tumor and its borders. Your doctor will use the scans to specify the three-dimensional shape of your tumor and vital tissues nearby. The tumor's shape, size, type, and location help your doctor determine how the IMRT beam should be adjusted to hit your tumor and avoid healthy tissue. During your procedure, a medical linear accelerator will deliver an X-ray beam to your tumor. A computer inside the accelerator will adjust the beam with a device called a collimator. The collimator will adjust or modulate the intensity, direction, and shape of the radiation beam. This feature allows higher doses of radiation to be delivered to your tumor while sparing your healthy tissue around it. You may receive many radiation treatments over days or weeks. This allows your body to recover between treatments and to kill as many cancer cells as possible.
So in the video we have seen that the gantry rotates around the patient, and you can find that the collimator is programmed so that the intensity beam can be varied with respect to the size and structure of the tumor. Okay. So that is what the modulated intensity, you can see that this is zoomed. Okay, this is zoomed. You can see the IMRT device in the left hand side, the small diagram, and that one is a zoomed version where you can find the collimator, how it looks like. So the collimator will be programmed and adjust so that the beam changes as the gantry rotate around the patient. Okay, so that's the completely computer programmed. Okay. So the linear accelerator must be equipped with computer controlled MLCs. So previously in the conventional linear accelerators, what we have used in the previous days for conformal radiotherapy. Okay, so they were sending the intensity towards the tumor and there is no control over the size and shape of the tumor to be applied the radiation. So it blindly sends the radiation towards around the tumor without any shape measurements like that. Okay, so it just roughly sends the radiation, and obviously there is a nearby organ tissue damages happens. If the nearby normal tissues are sensitive, they will get affected. Okay, so when I have a IMRT device in the linear accelerator, the MLCs, okay, the multi-leaf collimator is to be programmed. Okay, so they consist of nearly 120 individual metal leaves. Okay, that's what you can see, that so many leaves are present. I don't know how much clear it will be. Okay, in this, so there will be 120 individual adjusted metal leaves, and the leaves will move in and out. Okay, so which controls the radiation beam with respect to the shape. Okay, and it will block out the unwanted radiation and avoids the radiation leakage. Okay, so it should be computer programmed. So like what we have seen, the image of the CT and MRI is converted into three-dimensional, and the three-dimensional you are applying at different directions. The three-dimensional will vary at different directions, and as the device moves around the patient in 360 degree, at every direction the collimator has to adjust itself so that the radiation is applied to the tumor with respect to its shape. Okay, so that is what is being determined by the dose level histogram. Okay, so the MLC modes. Okay, the first one is the multi-segmented static field and the dynamic delivery, and third one is intensity modulated arc therapy. Okay, in MLC there are three modes: multi-leaf collimator. The first one is the multi-segmented static fields, the second one is the dynamic delivery, and the third one is the intensity modulated arc therapy. Okay, so the first one is multi-segmented static fields. Okay, so here the patient is being treated with multiple intensity fields. Okay, so here what happened is the complete intensity beam is divided into small beams, smaller beams, or so you can call it as a subfield. Okay, so it is worked in a sequence manner as the gantry moves around the patient. Accordingly, each beam will be divided into subsets. So in first rotation, a set of subfields will be activated. During the second rotation, the next subfields can be rotated, because as the gantry moves around the patient, this will be more advantageous as each sequence is applied in a simple instant of time. So accordingly, the delivery of the intensity beam also gets modulated with respect to the shape as the gantry moves around the patient. Okay, so the linear accelerator is turned off while the leaves move to create the next subfield. Okay, so this is the one of the main aspect of that one. So next is the dynamic delivery. So the shift happens only during the delivery of the intensity beam. Okay, so the radiation is on all the time, even when the leaves are moving from one static subfield to the next subfield. Here, the linear accelerator is switched off, turned off when the leaves are moved. It doesn't mean that it is switched off. It's just in idle state when the leaves are moving to create the next subfield. Here, the radiation is on all the time. Even when the leaves are moving from one subfield to the other subfield, the radiation is kept on. Okay, most of the times. Okay, this is the next thing. Next is the intensity modulated arc therapy. Okay, so this is one of the step and shoot method similar to that. Here the same MLC moves dynamically to shape each subfield while the gantry is rotating. Okay, so beam is on all the time, an alternative to tomotherapy. Okay, so you can see that the patient is kept still and you can see that the gantry moves around the patient. Okay, and when the gantry is rotating, the collimator moves dynamically, and each subfield has been applied in time basis. Okay, so intensity modulation arc therapy, that is a completely new one, but it always follows the same principles of the dynamic delivery and multi-segmented static field. So here we have a multi-static field, and we can say that it's like a combined one of dynamic delivery and static field. Okay, so multi-segmented static. So if you combine both of them, where the gantry rotates around the patient and the subfields are applied, and these subfields is been controlled by the leaf. Okay, so the leaf has been programmed. Okay, so that is what the multi-leaf collimator is designed. So the IMRT plan to treat tumor and avoid critical structures, and you can find that the first diagram is the tumor, and the second diagram you can find there are several markings which are drawn it like a freehand diagram. You can see that around the tumor you can see several lines has been drawn. Okay, so we can take it like the every radiation pattern. Okay, radiation pattern or the radiation beam pattern is divided based on whether we are going for a inverse planning or a forward planning method. Okay, so in inverse planning method, dose is fixed, intensity is alone is modulated. In forward planning, the intensity is being given step by step in an iterative way, and finally after we will decide the dosage of the isotope. Okay, so here the case you can see that some diagrams, nothing has been labeled, but you can easily understand that each line around the tumor represents, you can find that from the first diagram several lines have been drawn, okay, to represent where the field has to be fallen, and finally we get into a very shrinked structure. Okay, very shrinked structure which is very nearer to the tumor. Okay, the first the pink line or the drawn around the tumor. Okay, so that will be the finalized line on which the fields will be applied. Okay, so some of the applications of IMRT. Okay, so very important application is the brain tumors. IMRT can treat intracranial tumors, the most critical one is the malignant and benign. Okay, they are larger, irregular and solitary, and sometimes they are small, and you can even find the multiple brain lesions. Okay, that happens in the nerves and all. Okay, so IMRT limit the dose to our surrounding normal tissue, especially the optic curve, chiasm and lens. Okay, and brainstem. Okay, that is the main advantage of IMRT. So which is nothing but the minimization of damage to the normal tissues. The next application is the head and neck cancer. Okay, you can see that the neck cancer, how it is spread out, and you can find that the tumor is the dark portion is the tumor, and around the tumor you can see that several lines has been drawn around. Okay, so many of the technique issues for brain tumors also apply to head and neck. Okay, so limiting the dose will prevent other secondary diseases. Okay, like permanent dry mouth. Okay, these things may happen when they go for a head and neck radiotherapy. Those are critical stages when there is no options for treatment. Obviously, we go for a radiation therapy. Okay, so IMRT always limits the dose. So it's by case. Okay, either I go for a inverse planning or a forward planning, depends upon the type of leaf motion files and some of the characteristics of MLCs and the different modes. Okay, 3 modes. One is the multi-segmented static field, dynamic delivery, and intensity modulated arc therapy. Okay, so these are the 3 modes, and intensity modulated arc therapy, which combines the advantages of the multi-segmented static field and dynamic delivery.